fourth session of recently asked questions in examination. Today we will be talking about reasoning based questions. Here are few examples. Important reasoning based questions are here. Defecation after meals is a rule in children. Cardiac muscle behaves as functional syncytium. Role of MHC in tissue transplantation. Pediatric infections are more common in the first 3 months after birth. Why O blood group is universal donor. Importance of gradual ascent at high altitude. BP ratio is higher at the apex of lungs. Parasympathetic nerves act as nerve of emptying of urinary bladder. Why the use of hot water bottle is contraindicated in hypovolemic shock. Reflex bradycardia seen in the patients with high ICT. Conduction in myelinated neurons is faster than in unmyelinated ones. In scurvy, BT and CT are normal, still bleeding occurs. Tachycardia occurs more rapidly, severely in children. Tachycardia occurs during fever. Fixed principle as method of measurement of cardiac output. Blood pressure decreases when person stands up from the supine position. Titrate fibers effective in CVS diseases. Fetus is not ejected in uterus. Maximum ECG waves in AVR leads are recorded negative. Why? Name pernicious anemia is given to vitamin B12 deficiency anemia. Why? Coagulation cascade, complement cascade. Both are cascades, still they are different. Why? RAM disease is called as paradoxical sleep. Why? Perception of order tend to disappear when person is continuously exposed to same order. Why does that happen? Why apoptosis is referred as programmed cell death? Why loop of Henle is called as countercurrent multiplier and vasa recta as countercurrent exchanger? Why excitability of nerve is more than that of muscle? Postmenopausal females have high incidence of osteoporotic fracture. Why? Neuromuscular hyperexcitability, it occurs in tetany. Why does it occur? More examples are there. Interstitial fluid volume can't be directly measured. Systolic murmurs are more common in anemia. Once initiated, a motor neuron nerve impulse does not depolarize the area that is behind to the firing level. Why axon reflex is so called? In renal disease, why albumin is the first to appear in urine? Gendrasic maneuver helps to elicit deep tendon reflexes. Why? Tremors of Parkinson disease, they disappear during activity and are present at rest. Why? Blood does not clot inside circulation. Tubercular lesions are more common at the apex of lung. HIN in CSF, it is a function of PCO2 of arterial blood. Cervical injury above C3 is fatal, whereas below C5 it is not fatal. Sinoaortic nerves are called as buffer nerves. Heart rate increases during inspiration. Addisonian pernicious anemia, it is an autoimmune disease. Compliance curves are not straight but curved. Pregnant females have high cortisol without exhibiting features of glucocorticoid excess. Why does that happen? Few more examples. Hematocrit of venous blood is more than that of arterial blood. Physiological significance of apoptosis. Peripheral chemoreceptors are not stimulated in anemia and carbon monoxide poisoning. Supplementation with oxygen therapy may cause death in a patient of severe respiratory failure. You have to answer these questions. More examples are here. You can see the questions. Diabetes mellitus, why it is a disease of fat metabolism. Why estrogen is given in the postmenopausal osteoporosis. Oxygen hemoglobin curve is sigmoid in shape. Vital capacity is maximum in upright posture, etc. etc. Thank you very much. In the next session, we will talk about physiological basis questions.